Another question for any one of the panelists. There seems to be an increase in prescription overdoses. What is the reason behind this trend? Dr. Sondic or Dr. DeGutis?
Hi, this is Dr. DeGutis. We are seeing a number of things that we think may be contributing to this trend. We're certainly seeing an increase in the number of prescriptions that are written for opioids and basically the number of opioids that are distributed that really tracks the trend or the increase in prescription drug overdoses. So we think that has a great deal to do with it. And, you know, this increase is parallel. And as the supplies of the medications have increased, we've seen the increase in morbidity and mortality. And the supply is larger than ever. There's all kinds of new opioids that have come on the market. And we find that basically the quantity of prescription painkillers sold to pharmacies, hospitals, and physicians' offices was 4 times higher in 2010 than in 1999. And then enough prescription drugs were prescribed in 2010 to medicate every American adult around the clock for a month. This would be a dose every 4 hours around the clock for a month. So even though most of these are originally prescribed for a medical purpose, a lot of them end up in the hands of people who misuse or abuse them. So we think it's the supply and demand. Yeah.
I would only add to that there are also other avenues for obtaining these drugs in addition to legitimate prescriptions and then maybe handing them off. There's avenues from out of the country, for example. So it may be that, but it also may be that people simply don't understand the dangers involved and the different susceptibilities for different people to these drugs.
Thank you, Dr. Sondic and Dr. DeGutis. Another question for Don Castillo, or perhaps our OSHA representative. There have been questions regarding leading indicators for workplace violence and consensus standards. What are the best resources to use and potentially the best measures?
Yeah, so I'm not aware of any consensus standards per se, but there have been a number of regulations that have been promulgated at the state level, and there's also the guidance documents that OSHA has promulgated that we described. And within all of those, there's some core principles that include having very strong reporting practices so that any assaults, whether or not they result in physical injury or not, are reported to the employer so that they can understand what the burden is in their workplace and so that they can react to that. Another core principle is doing very rigorous hazard assessments to assess in that physical environment or that social environment of that workplace what are the hazards for the workers and therefore what can be done from the employer's perspective to protect them. And then another core principle is the engagement of staff with management and identifying the solutions, given that they're the ones who are actually doing the job, and they often can come up with solutions that the employer might not recognize. I don't know if you have anything to add to that, Mickey.
I would add also the sharing of information. Once that data is collected, the importance of sharing it with the employees, especially those employees who are likely to get exposed to the violence. Oftentimes we find data is collected and then it's not shared with the key people who could benefit from it.
Thank you, Don and Mickey. One final question, and it actually focuses on violence in the schools. So I'll reach out to Linda DeGutis or perhaps Paul Kesner from the Department of Education. Are there any good tools available, curriculum or videos, to teach youth about de-escalation techniques in the event of a violent event in the schools?
This is Linda. I mean, there are quite a range of school-based violence prevention tools and strategies that are being used, and we're not recommending any specific single item, but there are quite a few that do have some evidence-based. I don't know if Paul has something else that he would want to add to that.
Linda, I would say check out the stopbullying.gov site. There are resources there. There are some vignettes where, examples are given and different ways of responding, some practice situations. And it's an excellent resource, and different resources that are based on the needs of a certain school or certain group are available there.
And one other thing, the blueprints document that I mentioned a bit earlier that has at least 30 demonstrated effective programs. If you go to our website, it has links to those programs. That's another place.
Thank you, Paul and Dr. DeGutis. There's one final question, and I will answer it myself. We've had a large number of participants on today's webinar that have asked about Dr. Sondick's slides, and those slides will be posted on the NCHS's Healthy People website, and that can be, you can reach that site by cdc.gov/NCHS. So Dr. Sondick's slides will be available. Unfortunately, we've come to the end of our question and answer time, although we still have a number of questions queued up. At this time, I want to turn things over to Dr. Wanda Jones, the Principal Deputy Assistant Secretary for Health, to close out today's session.
Thank you, Dr. Wright, and thank you to all the presenters. I think anyone tuning in to this webinar today couldn't help but really be appalled, but also to some degree very heartened. The impact of violence and injury across the lifespan is something that, many folks think it's something for young people, or, they don't associate falls necessarily, and yet we see these devastating numbers for the elderly. And many folks are not even thinking of the workplace and the range of violence and injuries that happen in the workplace. So to look at this very holistic discussion today, to see these data, and to really realize we have much work to do, but we've done a lot. We're beginning to build this evidence base. We're beginning to look forward, and we're really taking steps forward that I'm hopeful by the end of the decade that we will see some significant progress on some of these numbers. Really salute the partners, because we, HHS, couldn't do this alone. Having the Department of Labor, the Department of Justice, the Department of Education working with us, in addition to many other partners that our partners have working on these projects, is really helping us have greater impact than any of us could hope to have alone as we leverage our resources, leverage our knowledge, and really help people take the actions they need to take to protect themselves, to protect their families, and their communities. So thank you all very much for your commitment, for your insights, and for some of the issues and challenges you've so beautifully described today. We all have a lot of work to do, but I'm greatly heartened, as much as I am stunned by figures that we heard, that we could have all been medicated every 4 hours for a month because of the level of prescription drug painkiller usage. It's just astounding. So thank you, Dr. Wright. Thank you to the Healthy People 2020 team. Let me turn it back to you, but thank Ed as well. Dr. Sondick, you've been a longtime friend and colleague, and have been a tremendous influence on my career, and I just can't say enough for how much your presence in these reviews has made a difference, and the leadership that you've provided at the National Center for Health Statistics. So thank you. We wish you all the best as you shift your priorities to your grandchildren and taking good care of the things that matter.